For small imaging centers, providing contrast-enhanced scans is a huge operational bottleneck. But what if the safest specialist wasn't in the building? Remote radiologists see more reactions in a week than some on-site doctors see in months. This remote model isn't just safer, it's faster. Some centers report 30% quicker response times compared to having a specialist on site. Faster and safer also means more cost-effective, cutting the expense of dedicated on-site staff for contrast supervision. In the next few minutes, we'll break down the best practices for virtual contrast supervision, from regulations to safety protocols and the tech you need. The entire field of virtual supervision is shifting, all because of a landmark decision from the Centers for Medicare and Medicaid Services. Starting January 1, 2026, CMS has approved a permanent rule allowing virtual direct supervision for many diagnostic tests. This is not temporary. The rule demands real-time, interactive audio and visual communication. A simple phone call is not enough. The physician must see and hear everything. This rule directly helps fight the growing radiologist shortage. A single specialist can now oversee multiple sites, especially in rural areas. Small centers can now extend hours into evenings and weekends without a physician on site, breaking down barriers for underserved communities. Virtual services also allow centers to instantly scale their coverage based on patient volume, giving them unprecedented operational flexibility. The benefits are clear, but it all comes down to one question. How can this possibly be as safe as having a doctor in the room during a reaction? The answer is the hybrid safety model. While the physician supervises remotely, a qualified licensed practitioner, like a nurse or PA, is always physically on site. The remote physician directs the response with their specialized experience. The on-site practitioner provides immediate, hands-on intervention. This model only works with high-performance, secure, and HIPAA-compliant technology. Real-time, high-definition audio and video are mandatory. Your technologist is the first line of defense. Their training must cover the technology and scenario-based reaction management with clear communication. So, with a strong safety framework in place, how do you make this a smooth, efficient part of your daily operation? Success depends on standardized workflows. From check-in to post-injection monitoring, a clear, repeatable process minimizes error and maximizes efficiency. This standardization is why centers achieve those 30% faster response times. There is no guesswork. Every team member knows their exact role. Best practices also include automated documentation systems. These tools use templates to ensure compliance and reduce the administrative burden on staff. The one-to-many model is a powerful tool against radiologist burnout, reducing the demand for after-hours on-site presence and improving work-life balance. This system is powerful, but the rules are not always straightforward. Let's look at a point of confusion that trips up many centers. Here's where it gets complicated. CMS rules and professional guidelines from the ACR and ASRT do not perfectly align. Whose advice should you follow? While CMS regulations may permit certain non-physician practitioners to supervise remotely, the American College of Radiology maintains a stricter standard. Their guidance is clear. Remote supervision should only be performed by a qualified physician. They also reinforce that a different licensed practitioner must be on site. Managing these differences requires seamless collaboration. Radiologists, technologists, administrators, and IT must work together to create compliant workflows. So who do you listen to? For patient safety, the answer is simple. Adhere to the stricter ACR and ASRT guidelines. Always use a physician for remote supervision. Let's connect this back. Remember the hybrid safety model? It allows specialists to focus on this single task across many sites, building expertise at a rapid pace. When you combine that specialized experience with the standardized workflows we discussed, you get a system that is arguably safer than traditional models. Finally, by reducing burnout and addressing the radiologist shortage, virtual supervision becomes a powerful recruitment advantage for your small center. So, what does all this mean for your imaging center? Let's recap the foundations of a successful program. First, efficiency, achieve cost savings and faster turnarounds. Second, safety, implement the hybrid model. third, compliance. Follow the strictest guidelines. Virtual contrast supervision is not a compromise. When implemented with these best practices, it is a superior solution for small imaging centers. Ultimately, this technology empowers you to expand patient access, improve care in your community, and thrive in a changing healthcare environment. Ready to implement these best practices? Download our full checklist from the link in the description to start building your program today.